$300,000 a year or whatever goes to medical malpractice liability insurance, which is insane. I know personally an OBGYN in Morris who says a few years ago he quit delivering babies because when a baby is delivered, he has to carry malpractice insurance for 18 years from his last date of birth to ensure that if any birth defects come out in that process, he can be held responsible. So he has to carry that insurance. So he stopped delivering babies. By the way, we're dumping 15 million people onto Medicaid as part of this new health care bill, when doctors are now saying, we're not taking Medicaid anymore.
That's right.
When Walgreens in Washington State said, we're not taking Medicaid patients anymore for medicine because we're not being paid.
That's right.
And then we're dumping more people into that system. That's kind of we need to shore some things up, and that's not right. Yes.
I have a question. It's a little off the subject, but for tax reform, income tax reform, I've heard a suggestion that possibly we could have, I don't know if it's a value-added tax, basically it's a national sales tax instead of an income tax. And the idea behind that was that there's so many people in the country that don't pay income tax because of their low income, but this would be fair because it would be spread out over everybody that buys everything would pay a tax.
That's called the fair tax, and the theory is if we get rid of an income tax and add probably a fairly hefty sales tax to all products, we would fund the government that way. The thing I will say is I believe we absolutely have to simplify our tax code, and it's a mess. And there's plenty of things we need to do. So we have a lot of questions, but go ahead. Okay.
The thing about it is that I think one of the problems in this country, and I think that the left exacerbates it, is this class warfare. It's kind of like the John Edwards thing, the haves and have-nots. But if you had a different kind of tax reform, people would be buying into the government rather than take it.
All right. Very, very well noted. Back here, sir.
Getting back to your
that always happens.
The tort reform, you talked about fixing that, and that may solve all our problems. From what I've read, tort reform accounts for 2% of the cost, while medical costs, mine especially, have gone up 20 to 30% in the last 10 years, maybe. With medical mistakes being the 8th leading cause of death in the United States, more than breast cancer, more than car accidents, what is tort reform going to do to fix that?
Well, I don't think tort reform directly makes medicine any potentially more safe. That's an issue of training and the fact that sometimes errors are made in medicine. Everybody's human. Sometimes there's misdiagnostics, things like that. I don't believe people should be able to sue, though, for $50 million or $8 million or $20 million for pain and suffering. That's where tort reform comes in and makes those limits in that abstract pain and suffering category. Now, there are direct costs related to that, and that's the 2% you're referring to, which I think that is actually a low number by some estimates. But then there's the indirect cost of the practicing of defensive medicine. So I'm worried about, and there's no way to really measure this, by the way. I'm worried about being sued, so you come in with an arm pain, sir, or your shoulder hurts. Well, instead of just kind of an x-ray of your shoulder, I'm going to give a full MRI and maybe even some other tests to make sure it's not something in your blood, when really I know in my heart of hearts you just injured your shoulder, but we got to now make sure, and so we're running a whole bunch of unnecessary tests. And I think if people looked at their bills really closely, and that's another thing we need is truth in billing, by the way, where you know how much a service is before you go and get it, and you're allowed to shop these services out, or you're able to see the price of these services, because a lot of times it's hard to find. So, but I appreciate the question. Okay, I guess one more question, and then I'll close up. Yes, back here, sir.
Yes, sir. Enforce our border. Can you tell me what that means to you and how you would achieve that?
Well, I appreciate the question. I've actually been involved in border security, if you want to call it that, with my job as an Air National Guardsman. I was involved in Operation Jumpstart, which was the Air and Army National Guard's mission on the border of Mexico, assisting law enforcement, things on that line. I believe in some cases there's a role for the Guard to play a support mission in the border. I believe obviously we need to add new border patrol, give them the technology they need, fencing, stuff like that, to make sure that you cannot cross the border. Now, it also includes control of the border to the north. to an extent. There's a lot of